Hello, let's talk about ankle arthritis. A lot of time patients come in and say, hey, doc, my ankle hurts. I had a previous injury in the past, or I'm a chronic sprainer, or I'm a very active athlete and my ankle hurts in the morning. It's stiff, it cracks, it pops. Um, but the first few steps are very painful in the ankle. Now, a couple things. Um, One common mistake I see is that patients tend to confuse something called the subtalar joint arthritis with ankle arthritis, and I'll explain that. Here's a foot model, a famous foot model. This is the if you look on this side, this is what we call the subtalar joint back here. This joint right here. This is the ankle joint on top, right here. Now, sometimes when you have pain in the subtalar joint arthritis, you'll have pain right on the side of the foot right here on this side. Ankle joint pain, a lot of time you'll have pain in the front, right along the front. The side down here is usually subtalar joint pain, subtalar joint arthritis on the side of the foot. This is the side of the, let's say the fifth metatarsal on this side. This is the first metatarsal, the big toe. Okay, this is the fibula, this is tibia to get some orientation here. So again, we're going to show you, this is the subtalar joint where people have arthritis, and if you have pain on the side, most likely that's what it is. Not always, but there's a high possibility you have subtalar joint arthritis. How can we tell it easily distinguish the two? Well, first of all, an x-ray a lot of times gives us a quick view of where the arthritic joint is, either the ankle or subtalar joint, or even both in advanced disease. Now, further beyond that, a CT scan or an MRI can be ordered to check out the degenerative changes that give us an idea of internally what it looks like. Now, how do we treat ankle arthritis or subtalar joint arthritis? Now, in a mild to moderate stages, we could do something called an arthroscopy. Arthroscopy basically is a scope we put in one side of the ankle, and I'm going to show a footage later on in the video of an actual arthroscope, and you'll get to see what an arthritic joint looks like through a scope. Now, this is the ankle again. We're going to go, basically we stick a camera in one side, make a small incision about 5 millimeters, stick a 4 millimeter camera in one side, and then stick something called a shaver or a suction device onto the other side. So you're looking in, and then you're suctioning from the other side. Now, a lot of time patients with something called anterior lateral impingement syndrome, you're going to have pain where the tibia and the fibula intersect. If you twist your ankle a lot and you get that little impingement or a little cartilage right in between here, it happens. There's a little divot right here. If I could show it to you, there's a little valley, I will say, that sometimes cartilage or tissue can get caught in between there, causing a lot of pain. An MRI can pick that up very easily, but a lot of time clinical examination with pain right about here in front of the ankle can tell us that is anterolateral impingement syndrome. That also can happen on here, anterior, which means front, medial, meaning the inside of the leg syndrome. It can happen on either side. Again, an MRI can pick that up, but sometimes it may be so subtle that an MRI cannot pick that up, and an arthroscopy is the only way to pick it up to visually see it. This arthroscope was invented back in the 1970s in Tokyo, and it's been used significantly for the ankle. Orthopedists like to use it for the knee and the shoulders, elbow, wrist, and even for an experienced arthroscopist, a mild disease in the subtalar joint can also be addressed. Also, this is a very small joint, requires very experienced arthroscopist to get in here and to be able to clean out the arthritis in that joint. That helps also. But for the ankle, for the foot and ankle, the ankle arthroscopy gives us the best benefit. I mean, people can have up to 50, 60, 70% improvement in their symptoms that you've been having for multiple years. And we don't burn any bridges once we do arthroscopy because nothing is damaged. With the proper arthroscopy procedure and technique, usually there's no side effects. And you're off your feet for about 2 weeks in a posterior splint or a cast, and then you get to walk in a boot for about 4 to 6 weeks, depending on your surgeon's protocol. So that's the benefit of arthroscopy. That's a little bit about ankle arthritis. Any more questions, please do submit them and try to answer them for you. Now we're going to go to a video of ankle arthroscopy.
This is the anterior medial gutter. We're going to go ahead and take some of this stuff out here. Copious amount of synovitis. Go ahead and take this out with a little bit of distraction. A little bit of suction. Joe, can you pull on the ankle a little bit more for me? Just tug on the line. Tug on the camo line. Yeah, just tug on it. Thank you. Yeah. Thank you, Joe. So I can get my instrument in there. Thank you. Okay, stop. I pressed it already. This is the anterolateral gutter. I'm going in right now, going after the anterolateral space. Keep bringing up any meniscoid loose body in there. Going in the fibula. That's the syndesmosis we're looking at. Go in there. Go in the gutter. Okay, Francis, hold this for me for a second. Get this light out of my eye, please. That light. So the anterolateral gutter looks to be clean. Anterolateral gutter appears to be clean. There's still a little bit more right here. I'm gonna go get that soon. Go get that little piece right there on the side. Torus reflex the ankle. Get my equipment in there. Get some of that synovitic tissue out. This is the syndesmosis we're debriding. Going down lateral gutter. Okay, now we'll take a look at this. Okay. Go toward the medial. I'm gonna go toward the medial ankle now. Medial gutter. Take a look at that. A little bit of synovitis there. No big deal. Gonna clean all that out. Okay, everything looks good. Clean out. Anterior osteophytes noted before in the picture is gone. We'll go ahead and clean all their junk out of here. Clean now, so I'm going to send the anterior neck. Range of motion looks good. Again, we're going to inspect the gutter. Anterolateral gutter impingement is gone. Capture image.